Welcome to Medicine and Healthcare Around the World, the podcast where we connect with passionate people from all over the world that are making an impact within the field of medicine and health. So, if you're tuning in to listen to one of our many great stories from wherever you are and wherever you're headed, please be welcome, friend, as we're about to get on with today's episode.
With global health, I think it's essential that you're doing sustainable work, that you're not just coming in and saying, oh, well, today, here's how I'm going to help you. But, tomorrow, you're out of luck because I'm not here.
Jeff Mapp, a pediatrician based in the US, recognized a profound need extending beyond his immediate practice. And so alongside his wife Kimball, he co-founded Extra Mile Pediatrics, an NGO dedicated to providing repeated, quality pediatric care to children in communities facing significant barriers to medical treatment in Guatemala and El Salvador. What truly sets them apart is their commitment to returning to the same communities time and time again. This isn't just about single visits, it's about building trust, fostering deep relationships, and ensuring that the impact that they make on each child's growth, development, and overall health is truly lasting and sustainable. Yeah, well, Jeff, welcome so much to the podcast. Do you know that you're actually living, in a sense, my dream life, in a sense that you're a doctor with a pediatric background, if I'm not mistaken, and you have this kind of humanitarian medicine global health initiative that is the Extra Mile Pediatrics. And we'll get into that and what you guys do and all of that. But I'd love, if you don't mind, to tell a little bit about yourself, your background, and what led to the creation of the Extra Mile Pediatrics.
Sure. Yeah, that's a humbling that's a humbling way to start. That living the dream, I guess, specifically for pediatric medicine, and then getting into global health medicine and sort of figuring out a way to make that work. It's been fun. I love it. Yeah, it's wonderful. So it's a long story, but at the end of the day, when I was really young and trying to get into medicine, I come from a family where no one in my family is in medicine. My mom's a teacher. My dad was a banker for a long time. I didn't really have any exposure to medicine, and I had an opportunity through a set of circumstances back when I was in undergrad to participate with a doc. He was a pediatric neurosurgeon. And at the time, he regularly took teams of neurosurgery, anesthesia, nursing down to Guatemala. And I had an opportunity to travel with them, which, obviously at the time, my main goals were that it would give me some insight, a little bit of insight into medicine, give me some exposure, an opportunity to just kind of see how everything works there. And then obviously, in the back of my mind, thought that it would also maybe help as far as, building the resume and application for medical school and that kind of thing. So I went, and I went really with just those expectations, right? Just those two big goals.
Right.
But I tell people now that was such a significant thing, because that was my first view of medicine. Like, other than being more on the consumer side as a patient, right? This was my first time seeing medicine practiced, and the fact that happened in that setting, and with those patients and with those resources available, and the way I saw medicine practiced for the first time was in Guatemala with patients that had spent unbelievable effort just to get to the clinic, all of those things. And so to have that exposure first and then kind of proceed through the medical system and medical school and residency and all those kind of things in the US, and seeing all the unbelievable resource availability that we have and all those kind of things. But I always was seeing it through that lens of what's available in other places, and what the reality is for a lot of people in the world. And so that was just put on my heart early. And I think, always was there as a eventual goal once I was able to get through my education and my training and all of those things. I knew that I wanted to get back to that kind of work. And so fast forward a little bit, obviously just the busyness of medical school and residency, and then starting my own family and all those kind of things. There was a period of time where I wasn't doing this kind of thing, but once I felt comfortable, in a lot of ways, from a career standpoint, from a family standpoint, and all those kind of things, I got back into it and just really kind of dove back in with both feet.
Mm.
And the whole process came full circle as far as starting Extra Mile Pediatrics, about 7 years ago, in 2018. And the other piece of the kind of journey to get me to that point, was that in 2013, I actually went back to school, and added a business degree. I had been in practice for a while, and again, at the time, my goal wasn't, I'm going to go to business school so I can start a global health organization. My goal was to say I was part of a private practice. I was a part owner. We really were looking to gain some financial leadership, and so I went to business school for that purpose. But now, again, looking back, I sort of see it a little differently, in the sense that, at simultaneously, that at that time in my life, I was doing a lot of work in global health and seeing how a lot of other organizations do that work, and sort of saying to myself, man, I want to do this a little differently. And I think having that very, pardon me, having that very recent background in business allowed me the sort of, gave me the confidence to take that on, right? From a organizing standpoint and from a financial standpoint and all those kind of things. So that's kind of that's a sort of brief story in terms of how I've gotten from there to here.
Mm. Mm. That is so fascinating. Also, how you could combine it with business school, because I imagine it have helped you a lot in running also. And if I'm not mistaken, Extra Mile Pediatrics is an NGO. But I wanted to ask you about the part where you went to Guatemala before we dive into the Extra Mile Pediatrics. What was it specifically that it almost sounds, when you describe it to me, that there was a calling for humanitarian medicine or global health initiative, always in the back of your mind through med school, through residency, through the private practice that you built. And what was it about the Guatemala experience more concretely that made you eventually, I think you said 2008, start the, 2018, not 2008, 2018 to start Extra Mile Pediatrics?
Yeah, I mean, I think I've always part of what attracted me to medicine to begin with was, medicine is very much a service, it's very service oriented. Pediatrics specifically, I've always been interested in pediatrics. That's really, throughout my process, I've sort of thought about different subspecialties, but it was always within the context of pediatrics. That's just, you said calling. That's always how I viewed myself. And again, there's this sort of sense of purpose. And so, I think that was just part of my wiring, from an early, age, was just that there's a component of this that we're doing to serve others. And I think that when I was in Guatemala, what I saw was just this opportunity at just a super high level to do that service, because it wasn't just a matter of meeting families or patients and their healthcare needs. It was meeting families or patients and their healthcare needs when they really had very few options, when they were very dependent on your ability to comprehensively meet those needs and do it in such a way where you were overcoming other barriers that weren't specifically healthcare related, right? Be they financial or living circumstances or geography, even, those kind of things in terms of like where access to medicines and to studies and to all the things. So I think I just that time I spent in Guatemala, I actually went twice with that team. I went in consecutive summers after, basically on breaks between semesters in undergrad. I went twice because I just was like so taken by it, and just I loved it from the get-go. And then there's a piece of it that I will say, like, um this may have happened wherever that experience, had that experience been in, you know Uganda, where I later traveled to, or what, I could have had the same connection, but also something about just the people that I met there that were so warm and just, welcoming, and it was just absolutely delightful to work with, that I immediately had a heart for that place, those people. And even if you take the medicine out of it, it just was like one of those times where you connected. And so I think those were the two things. And like you said, that ended up feeling like, hey, this is supposed to be part of what you do long term. This wasn't just a come see how things look and add something to your resume kind of that's not, I didn't leave with that view. I went into it with that view, but I left with a view of saying, man, this is, how can this be something that you do on a regular basis long term?
So, no, I can completely agree with you in the sense that there is kind of a warmer, friendly environment, in Latin America. We have, I've told you that I've studied, or I wrote to you, I think, that I've studied in an international course, and we have like a few Latin Americans, people from Brazil, and get the really warm South American feeling for sure. And uh, I just love how this became then the idea. You said it could have been Uganda, it could have been other places, but there was this calling, the warm environment of the Guatemala. But guys are not just when you started this out, or maybe you did when you were about to start out, but you guys are active in Guatemala, but also in communities in El Salvador. So if we may now enter into the organization a little bit, and I could ask you a little bit about what it is that you guys do, and then we can go into the specifics and all of that. But it is you do this, I don't know if it's called medical missions or service trips, where you kind of serve the community. I thought you put it so beautifully, like medicine is it's a dedication of service. I really 110% I agree with that. It's a dedication of service to the people that are less come from, the lesser fortunate. And so when you started out, how was that 2018 when you were like, okay, I'm going to do this in Guatemala, El Salvador? What did it take to build up the organization?
Yeah, I kind of look at it. I tell folks that we started the model first. What we created wasn't like, hey, I want to go to this place specifically. It was really more like, here's, if I really wanted to do pediatric specific global health type work and really serve these types of families well, here's how I want to do that. Here's how I want to set that up. Here's what I want the organization to take on. So we kind of created that first, and then knowing that the need is just like everywhere, right? There's so much need out there. So we create the model first, and then we set out saying, okay, what communities will this model work well, and then what communities won't work as well with this type of model, right? Which ones will we be biting off more than we can chew, and so we basically, the way that came about was I had done a lot of work with other organizations, well before 2018. I had been doing global health work, basically just volunteering as a part of teams with other organizations. And I loved many aspects of most of those. But what I found was, I see the world as a general pediatrician. And so my primary view are things like preventive care, right? And things like development and growth and nutrition and those basically those kind of foundational, right? As a general pediatrician, it's really that early childhood development, early childhood, nutrition and growth and all those things. And then it's, chronic care management of what have you, asthma or, those kind of things. And I just see so much value, especially in global health, in communities where families may have poor access to care. The more you can get in, even while patients are well, and kind of make tweaks and changes that help prevent them from having issues and prevent them from needing the access, more than they already do, and that kind of thing is huge. And with global health, I think it's essential that
Mm.
you're doing sustainable work, that you're not just coming in and saying, oh, well, today here's how I'm going to help you, but tomorrow you're out of luck because I'm not here, right? And I think that pediatrics fits really well into that, in the sense that if you're periodically checking in on children, and you're measuring their growth, and you're having discussions with families about how they're eating and all those kind of things, you can make a change on a day that then will impact. You can say, hey, why don't we incorporate this, and then let's check back in a few months and see how that's worked for you, and see how growth has gone, or whatever, evaluate whatever change we made. That works actually quite well, right? And so basically what I was finding when I was out with other organizations was, every time I saw a family and they would come in with their children, their questions and their concerns were things that I felt were hard for me to answer in one day. It's very hard when a parent comes and their chief complaint, their presenting problem is, I feel like she eats very well, but she never seems to gain weight, or I feel like he's too skinny, or, those kinds of questions come up a lot in these circumstances. And you can't answer that in one day, right? I found myself saying over and over when I was working with these other organizations, I'm like, man, I really need to see that kid again in 3 months or 6 months or 9 months. And then I can really actually answer that question, because, there's a difference between just being a thin person and not growing well, right? And the growing well part of it is a longitudinal thing. It's you've got to see. So basically the major thing that I think sets Extra Mile apart is our whole model is built on that piece. It's built on saying, we're going to go back, whatever communities we enter a relationship with, it really is going to be a long-term relationship. And if I set up a clinic in X location, then I'm going to go back to exactly X location on a regular basis. We've chosen 6 months as our interval, for various reasons, but we're going to go back every 6 months to this exact location. I never want to see a patient where I can't say to them as they're walking out of the clinic, hey, here's when I'm going to be back, right? I'm going to be back at this exact location on this day, so that they know where the access is. They're very familiar and all those kind of things. And I think that there's a ton, and we can get into this a little bit more, but everything flows from there for our organization. And what we found is that in El Salvador and Guatemala, we have in each country, we have about 5 different communities where that has worked extremely well, where a minimum of 60% of every patient that walks in the door, 6 out of 10, we've seen before. And in most cases, we've seen them multiple times before. So I've got this beautiful growth chart to go over with the family, because I've got that longitudinal data now, and we can really get into how things are going. But more important than that, with all of those visits, I've got this relationship with that family built up, from our organization. And what comes from that is sort of the what it's funny. We started Extra Mile with that, hey, we need to be back here for in order to answer these questions about growth or development or whatever. But what we found after we've kind of gotten into it is, man, the trust that you build by just continuing to show up changes everything. It's really like that was I don't, it shouldn't have been surprising, but that's the thing that I have found as I've done this longer and longer that I value the most, actually, is that the impact that continuing to show
It
up.
it it brings a soft spot in my heart. This is what medicine should be all about. The kind of building of trust, which I think, I don't know how you guys are doing in the US, but in Europe, it is so kind of automized with the healthcare, and to the point that, and the doctors are so stressed. And of course, we have a shortage of doctors in general, and you just get the kind of patient being almost like on the treadmill band going in and out, and it loses the kind of doctor patient relationship. So when you talk about the kind of building trust with the families, it brings to mind the kind of, I think it was Jennifer Jacobs and colleagues that did a study on service missions. I'll link it in the show notes, maybe show a little bit of editing, nice video editing on that. But they kind of did a case study, I think, where they showed that these service missions, medical missions, can really be beneficial if you take the needs of the community in mind. And when you just start telling these things of building trust, that you go every 6 months to these communities to kind of recheck, do a recheck with you talk about the growth charts, the development of the children. And I just think that's such a beautiful endeavor that you guys are doing. And I imagine also this must have been hard. You talked about the models a little bit. You chose models that worked really well with these communities. And I'm really interested in learning, because maybe I will do this myself in the future, the way I'd like to really learn. And for other listeners that are interested in this kind of global health NGO endeavors, what kind of, so building trust, maybe that we can call it, I don't know if it's one of your core values, but trust building seems to be one of them. And could we talk, if you don't mind, about maybe other things that you saw, okay, this works well in El Salvador and Guatemala in terms of the model that we're using? So essentially, maybe touching a bit on these models. What are they?
Yeah, so I think that the size and the definition of the community is pretty essential, right? Like what if we're if one of our main goals, main focus is to see the same families repeatedly, then a big city, a big urban setting where there's lots of ingress and egress of patients, that kind of thing is going to be much, much more difficult for us to sort of achieve that goal, right? Of seeing the same families over and over again. So what we've found is what works very well for our particular model is, um, communities that are a little more on the remote side, right? That are a little more, uh, again, well defined as a community. And that doesn't necessarily need to be the geography, although that does help, right? We have several we have several communities where they're remote, and because of that, they really are, you see the same faces, this the sort of borders physically of the community and all those kind of things. And we know that if we are within that community, we're going to see those same families, right? So that does work well. It also, you can have that definition of community be another connection. So maybe it's a school, maybe it's a church, maybe it's that sort of, the organization of the community can also be what defines it. And we have some other communities where maybe they're a little less remote, but they're well organized in that sense. But that's what we have found works well for us. And I would say that for the most part, that means that the communities we serve are a little further from the big cities. Generally speaking, it's a population that has a little bit of a difficult time, certainly has a very difficult time accessing healthcare, right? In both places, there are some options for them to seek care if they need it for their children, but it's difficult. It's very, very difficult. And and really maybe not all that realistic actually that they will be able to do that. So basically those are the two big things that sort of fit our model. Do you have that definition that's going to allow that if we come back 5 times, are we going to have a great chance that 4 out of the 5 times we'll get to see the same families, or whatever the case may be, that we look for that piece. And then the second thing is it true that you really don't have great access to medical care already? Because the other thing we never want to do is go in and undermine something that's already in place, right? And so if you've got a community that has great access, especially if it's local, great local doc, local clinic, local hospital system, if that stuff's in place, that we are not going to step into that. That's just because that's the ideal, right? That's where you want. I tell our teams all the time at the beginning of our field team trips, I say, look, we're not here because we know how to do this better. It's not that. We don't have any better training or any better knowledge. We're here just to solve the access problem. So I never want to be that group that shows up and says like, well, we'll just do this here and they'll come to us because we're better docs. It's like, no, that's not our posture whatsoever. It's right. We really want to come here to meet a need that you guys have. If you can't already get this kind of service, then we want to start meeting that on a 6-month basis. And then after we've gotten to know you and built that trust, we're going to see what programs can we build that are longer term, that will just live here, that aren't on a 6-month basis, that we can kind of have set in your community and that will move forward.
Again, taking the needs of the communities in mind. But was this a trial and error process in finding this kind of model with the more, correct me if I'm wrong, but I'm understanding it that you guys go to more rural communities with maybe poor access to health in general. And uh, was that hard to establish the initial contact? And how do you do it? Do you reach out by email? Do you talk to people in the vicinity? So you have a lot of communities in Guatemala and El Salvador. How do you specifically look at, maybe, okay, you talked about the kind of, okay, if they have a healthcare access, that's good, let's leave it aside. So maybe that's one of the criteria that you guys look at. But let's say that I'm guessing that you guys found some accesses that weren't that good, and you go, okay, how do we go into this with intentions of doing good, but not kind of compromising or telling the local community what to do? How do you do that?
Yeah, that's a great question. And definitely, yes, that has been a challenge.
Just a quick break, and we'll head right back into the episode. No, so taking the needs of the communities in mind as you're starting out, how do you do that? That you look at the communities, you have your different communities in El Salvador and in Guatemala, and you look at, okay, and you told me about one of the criterias there. Okay, if the healthcare access is good, we'll leave that alone. But let's say what we find that place, we're asking a little bit about how you went on in communication wise. How do you reach out in a proper way without, like we talked about, kind of negatively affecting the local community or telling them what to do?
Yeah, so we had our first contact with a well, let me back up. I think that the key to me is finding the sort of true organic community leaders, right? Like sometimes community leaders are very official or maybe even elected, leaders. But in many instances, the person that really knows the community well and really has built up that great, reputation in the community, or really is well connected in the community to the people, it isn't necessarily that person, right? And it might be a church leader. It might be the leader of a different NGO, right? That's doing other kinds of service work, right? It may not be medicine, but they may be doing other kind of service work in those communities. What we have found is that there's a very broad network of those types of people, right? And so we got connected when we sort of started um, working on getting Extra Mile Pediatrics launched and off the ground. We were connected by some mutual friends that were in global health, just with another organization, and said, hey, there's a family, a group up in El Salvador that you should talk to, and so very kind of organically, them knowing what we were trying to do, and then they had enough experience with different areas to say like, oh, there's a group there that you ought to talk to, because this seems like it might work there. And then it kind of goes from there. And again, I think the key piece to us has been finding that people that have been involved in the area or the communities that you want. And it doesn't need to be, in fact, I kind of think there's a real advantage to finding folks that are doing other types of service work in these areas. And so for example, in El Salvador, we've come to work very closely now for a long time with a group they provide water filters, water filtration systems, for clean drinking water for families. And then they do,
Wow.
and there's such synergy there because they've got a great feel for size and scope of communities. They've got a great feel for how receptive communities are to this kind of work, and all of the things. And then you can kind of build on that relationship. And obviously that particular work has high implications in healthcare as well, right? Clean water is everything. And so that was but there's other types of non-medical, there's outreach programs that might be doing education, or might be doing, something in the nutrition space in terms of, supplementing kiddos with, that kind of stuff. And so I think that's a really great place to start. And then I think what we had found is once we were a little more established, then it kind of went from there, because then it's a matter of people can hear through the grapevine of like, oh, we could really, they see what you're doing and say, we could use that here. And then you can start having those conversations. We've had, lots of opportunities come up where folks were somehow made aware of what Extra Mile was doing, whether it was social media or whether it was, a friend of a friend or whatever. And they'll contact and say, hey, like, what do you think about our area? Would you consider expanding, and that kind of stuff? And so, but I think that initial contact, that's what you're really asking. And I think finding those people and then reaching out through whatever means is best, right? Whether that's email or phone call or whatever.
Mm, mm.
Is a great starting point. And then you can kind of get a feel. And what we usually would have done is, once we made that initial contact, had that initial conversation, then we have a very small group, like a little bit of a scout team from our organization that will go to the community, not to practice, but just to go and just to visit and sit down face to face with community leaders, get a feel for what everything looks like, really get in there and ask a lot of the questions we just want to make sure we don't ever take on, because our commitment is to the long term. We don't want to launch something that then we would have to say, ooh, you know what, this isn't working well, we have to back out of this. I'd much rather do all of that work on the front end, because it's really about that longer term commitment.
Mm. And again, if I imagine that I were there, hearing the story that, okay, there's this organization, they're gonna come back every 6 months, and I also love the holistic approach. So you talked about the kind of water purification project. It sounded like that you collaborated with, and as good at it as it is to treat someone for some kind of pathogen that comes from the non-sanitary water, you need the holistic approach. You need to look at the water purification. So otherwise, the patients are just going to come back to the hospital. And I love, and you talked about like some kind of dietary intervention. It sounded like that you guys were looking into too. And it's again, referring maybe to a little bit of how things work in Europe here. Maybe it's again not, there's a tendency among doctors, from my experience, the internships that I've done, to only be focusing on signs and symptoms, treat, bam, and then they come back 2 weeks after with a new, without looking at the diet, for instance, without looking at the holistic approach. Maybe not to talk too much about it, but with the people that are pre-diabetic, for instance. They are not diabetic yet, but their hyperglycemia, their blood glucose levels are going up a bit. And you can it's a lifestyle. You can do a lot of personal things in your life, like working out to lower the blood sugar levels. You can eat in a certain way that doesn't spike your blood sugars. And it's just, this is, I see the tendency among, I can speak for Italy and Sweden, to just prescribe metformin. This is, I don't know if you call it that in the US, but it is the main drug used for people that are diabetic type 2. And so instead of saying those kind of tips and tricks of how to deal with that, I'm just making a comparison between that and the water purification, the kind of holistic approach. I love holistic sustainability in this case. And so if we go into the organization a little bit, you do the service trip every 6 months, and you have a team, I imagine, of medical doctors. And could I ask you, what are then some of the challenges that you might, because I imagine that you guys don't bring an MRI scan or a CT scan with you, a little bit too big, maybe a portable ultrasound scan you guys bring, but the kind of and also you kind of exposed to other kind of diseases or pathologies. I imagine maybe neglected tropical diseases that might not be as common in the US or in Europe. How do you use creativity and innovation to kind of tackle problems that you might not see back home compared to when you go to Guatemala or El Salvador, and use the creativity and innovation to try to treat the patients that you have?
Yeah, you're right. You're certainly practicing in a pretty resource limited, our teams themselves are really not equipped with a lot of what a lot of what you said. Certainly we don't really have imaging to speak of, certainly not in terms of advanced imaging options like CTs and MRIs, those kind of things. And then same thing with lab work, right? We've got a variety of like point of care type testing that you can do. You can test fairly easily, urine and maybe even hemoglobins and hematocrits and things like that. But in anything more, a little bit more in depth is going to take some doing. So I think the first thing, and this isn't really innovative, it's just sort of trying to do the hard work. It's really building the connections and the networks to the local system, right? So that's the first thing, is finding where are the partners that are sort of nearby these communities that the patients may not have had access to if we weren't here, because they just didn't know how to navigate the system, right? Or whatever the case may be. Let's find those partners and say, like, if I need this, which fortunately with pediatrics, especially general pediatrics, the kind of work we're doing, the majority of kids are fairly healthy, right? It's really a matter of keeping them that way and sort of making those small changes and small tweaks and small pieces of advice that make a big difference over time. But we don't have as much, but inevitably you run into situations where you've got a kiddo that you need more diagnostics on, right? So like we'll have teenagers that are complaining of some chest pain when they exercise, and you say, man, I really would love to have, an EKG or a echo, on this kiddo and that kind of thing. And in those cases, basically we take that on as, our responsibility. If we're going to go into these areas and see all of these kids, we've got to see that through. And basically that just becomes a game of communication and using partnerships to say, okay, we're going to get you into a cardiologist at the children's hospital. It might be 2 hours away. And this would not have been a reality for your family to be able to get there, but we're going to help fix that. We're going to figure out what's the transportation options look like. How can we coordinate this? How we'll stay in touch with mom or dad on WhatsApp and kind of guide them through the process and that kind of thing. So we're using the local resources and the local system that's in place, because I don't, unless it's absolutely necessary, I don't want to go outside of that, right? This is the whole thing is creating a better local solution for these families. And so that in a lot of cases that works. I will tell you, the place that I've felt where we need to continue to work on some innovation is that's very common and very, well, maybe not specific to pediatrics, but just common in pediatrics, is when you look at things in the development space, right? Gross motor, fine motor, verbal delays, and those kiddos who could use the extra help um, with therapy, speech therapy, occupational therapy, whatever the case may be. That solving that is a difficult thing. And so we've piloted a few different attempts. We've piloted a telehealth program where we could continually meet with kids to work on their speech and articulation with the use of kind of laptops and hotspots and interpreters and local to the states. Speech therapists, I'm sure, connecting those dots and helping educate the family on how to then do the speech therapy in the home. And so those kind of things we're working in that space now, because in peds, that's a huge piece, right? That's a huge, we're almost never going to go see a clinic's worth of patients without identifying some kids that need that kind of service, right? And those are the kind of changes that really do make a difference long term. So there's all those challenges, and I love those, because I think that's when you get to really put on your entrepreneurial, innovative brain and say, like, how can we fix this? And the great thing about our model is that we don't feel like I have to fix it that day while the patient's in front of me, because this is a long-term relationship. If I know the family and I know the family is, trusts me to go solve this problem, I just need to sort of have their permission to say, hey, can I give you a call next week when I figure this out? Or next month, or whatever the case may be. And it's a longer term thing, but I think that's, those are very challenging, but also can be pretty enjoyable as well.
Especially when when you have success in those fields. And I imagine then that, if you have to take a child to a certain center, outpatient clinic, or a hospital 2 hours away, like you said, you will need the trust of the parents. And so when you've done the hard work of building that trust, like you say, I feel like very much the trust is what we're putting emphasis on during the discussion here when you do your medical missions. And I absolutely, I, I, I absolutely agree with that. And it just facilitates then that they are trusting you with this kind of trip that you take the child on. And yeah, again, I feel like we call it my blood is boiling, but maybe that's an Italian expression. But it is really a boiling out of excitement, to the point that I can't even come up with the questions that I want to ask. But luckily, I have a little cheat note here. But so far, really, I wanted to say it at the end, but also now, congratulations, really, for the hard work that's probably pay off, the trial and errors that you guys have gone through, and it's just really inspiring. I just wanted to ask then, with the uh, build trusting, that's very important part, like building the trust with the communities. The kind of networking seems also to be very important, networking with the local communities and look for corporations. And you talked about like going to an endeavor here to connect through telehealth with speech therapists in the US. It's kind of, yeah, you have to put your creative mind into it, and the kind of entrepreneurial spirit, like you said. And I just love that, hearing that. And so, talked about the challenges that might come with doing like, and yeah, I also wanted, sorry, to add that you also, apart from also maybe diagnosing, doing checkups, physical examination, the best you can with therapeutic tools, you're also kind of a middleman. It sounds like Extra Mile Pediatrics. So you talked about the kind of trip needing to get this kid 2 hours away from to a hospital or outpatient clinic, or I can't remember exactly what it was, but were you then responsible in this case for getting the kid like driving over there?
No,
Just
no.
curious
I
about that
mean,
specific.
certainly we would be, willing to take that on, but oftentimes that's the work that's happening between, we're there physically with our teams of people every 6 months, but in that interval time between this, between those teams is when we can oftentimes are carrying out these, just because it takes time to put to connect the
Mhm.
dots. We have a patient in Guatemala that I'm thinking of who needed some surgical intervention, basically had stage 1 of a surgical procedure, but needed to have it, have the procedure completed essentially. But the family had kind of basically lost the ability to continue going, they just, for all the reasons, right? For financial reasons and for transportation reasons and for all the reasons, they had just sort of, and so we were able to get that child in through just essentially just working the phones, right? Working the phones and working the connections, and leaning very heavily on our partners to say like, hey, do you know folks locally that can, and then they say, no, we can't, but here's a place that can. And you eventually find that pathway. It just takes the sort of the man hours, right? But
Mm.
oftentimes when that door opens, it's then it's a matter of, we may not physically be there at that point, and it's a matter of coordinating, right? And so we've got those pieces that's where the like infrastructure of an organization like this makes all the difference, right? That's where I think going ahead and instead of just saying, hey, I'm going to just volunteer whenever I can and I'll just go down there whenever I can, it's more like, no, you need to we need to create an infrastructure that's going to be there when it needs to be there,
An
right? And so
ecosystem.
we have, we're still a super small, super young organization, but we've been able to add like a operations person on staff here in the States. And we've got sort of teams of folks in country that we work with very closely that are very dependable, and we can contact them and say, hey, could you possibly help this family with the like bus routes to get from here to there? And like, can you just make sure that they understand where they're going to, that kind of thing. Um, that we can get that done. And that's the way we sort of end up carrying out. It's almost always happening though, kind of on this ad hoc basis, right? Where we've kind of you just got, and then once the opportunity's there, you got to capitalize and say, okay, well, let's, this doc said they'd see them tomorrow. Let's get them there. Or,
Mm.
so it's been,
I love
but,
that.
but it has been in most cases successful. And that's, like you said earlier, it's a big challenge, but that's also like those moments are when you really feel like the you get the fulfillment is pretty
Mm.
high in those moments.
No, it's like it sounds like such a huge ecosystem, keeping everything running. But a part of the ecosystem, if I'm not mistaken, looking at your website, is that how people can contribute. So there is the usual donations, but also I saw something about the volunteering program that you have, that people actually can participate in this, and you don't necessarily, if I'm not mistaken, have to have a medical background. And could you, if you don't mind me asking, talk a little bit more about how people can contribute in general, and maybe more specifically with this volunteer program that
Yeah,
you have?
for sure. So our teams generally consist of about 12 to 15 volunteers. And then once we arrive sort of in country, our team grows to, generally speaking, 20 to 22, because we have a group of interpreters that we work very closely with, and have been for a while. We have, uh, some local kind of directors and those kind of things so our team will eventually be about 20 to 22 people. But as far as volunteers that sign up to travel from wherever they are to go participate on these teams, it's generally 12 to 15. And the breakdown of that typically goes 4 to 5 of those are docs, about 3, maybe 4 of those are nurses. And then we have a handful of non-medical folks, right? And there's a super wide range of what non-medical can be. These can be, family members of other volunteers, or they may be somebody that's, a younger, like I was way back at the beginning. We talked about me, going to Guatemala when I was an undergrad. We get a lot of kids who are in college who want to pursue careers in medicine and would like to volunteer. So sometimes those are the non-medical, but it takes all those types of volunteers for us to really run a successful clinic, right? We need to have folks, um, there to see the patients, the pediatricians or family practice docs or whatever, whatever their background is. But we equally need some person who doesn't even have to have a medical background, but to check patients in when they arrive at clinic and to help guide them through the clinic process and to, those kind of things. And so, anyone can volunteer for these, and you're absolutely correct. You don't have to be a Spanish speaker. We have amazing interpreters, and frankly, we would hire those interpreters even if we had Spanish speakers, because there's still, apart from the language, there's that local knowledge, right? That I think of, just like cultural awareness type of knowledge that I think they bring to the table. That's just invaluable. But so you don't have to be a Spanish speaker. You don't have to be, basically, you just have to have that willingness to that open mind kind of approach of, I just want to jump in and see how I can help and be willing to help. And there's a little cost to it. Part of our financial model is that the volunteers on each team are raising a certain small portion. We try to keep the cost extremely low, but they're raising a portion of the cost of executing those clinic days, right? So generally speaking, if I sign up to go on a team, I'm going to be raising some money on my own. We are a nonprofit NGO with, tax deductions and all those kind of things. And so it's not a super onerous process. And I do think we keep our costs pretty low comparatively in this space, right? That's a pretty common thing, that volunteers will be raising their portion of the funds with various organizations, but we keep that number really low because we just feel like, just like we don't want our patients to feel any barriers to come see us to seek care. If we have a volunteer who wants to volunteer with us, we really don't want them to run into barriers, and financial barriers would obviously be a big one, that we're hoping to keep that low so that anyone with the heart to do this can do this. So yeah, on our website, you can go and look at when the trip dates are for the El Salvador teams and the Guatemala teams. And anyone can throw an application in and we'll see what works, which is fantastic.
Exactly. Yeah, and I'll make sure to mention that in the show notes, also in the video version that you can see on YouTube. I'll make sure to also show a few nice pics of the website and the volunteer service for sure, and a link to that in the show notes for sure. And yes, Jeff, I think we're reaching the end of this beautiful conversation. I told you earlier, but again, you're kind of living my dream life in this kind of humanitarian medicine endeavor that you're doing, and the hard work that you seem to be putting into it. Having a family, like you told me, maybe you're working also as a general pediatrician or in an American hospital or clinic. And it's just, I imagine a lot of hard work goes into that. And it seems to also pay off with the model that you're using of essentially building trust. And really good luck from the bottom of my heart I really hope this takes off, because it sounds like a really good effort, something that I promote willingly, and really best of luck with this with all your future endeavors.
Yeah, thank you so much for having me, and it's been a really nice conversation, and I appreciate the opportunity to share what we're doing. This is a great way for more people to be aware of different ways you can kind of approach the whole global health puzzle. And I hope that the Extra Mile Pediatrics version of that kind of appeals to some people. So I appreciate it. Thank you.
Thank you so much for listening to this episode. I hope it brought you a new perspective, a moment of reflection, or even just a little bit of joy. You can find the video version of this episode on my YouTube channel, links in the show notes. And if you enjoyed the episode and would like to see more, please consider giving it a like or leaving a review on Spotify, Apple Podcast, or on my YouTube channel. Your support really helps others discover my content, and so, again, thank you for listening and for being part of this. I'll see you in the next episode of Medicine and Healthcare Around the World.